Everyone, and welcome to today's training on effective outreach strategies for health ambassadors. Today, my colleague Mark and I are going to be talking about the definitions of outreach and engagement, some guiding principles for effective outreach, best practices in outreach and engagement, outreach safety, and successful outreach connections and transitions. This is a recorded webinar, but we actually did this training with a group of health ambassadors in the past. So you will also be getting some of their real-time responses that they shared during that live training to some of the questions that we have posed. The first question that we asked of that health ambassador training group was, what does outreach mean to you? So you can see here, some of the responses we received were providing help at street level and meeting people where they are, helping those in the community with services that can better their lives, communication with community, great tool for work with community members. Outreach means reaching out to our community and helping our community grow, engaging in the program that they may need, being able to help our community where they are, no matter the circumstance. So you can see there are a lot of great responses about what outreach means in terms of connecting and engaging with an individual, as well as the wider community. It really goes into this definition of what is outreach. It is a service to connect and engage with people experiencing homelessness wherever they are. So oftentimes outreach takes place to people experiencing unsheltered homelessness, which means they are residing on the street, in encampments, in vehicles, or another place not meant for human habitation. However, outreach can take place in a number of different settings, including in-reach to shelters, hospitals, other health programs, jails, many different circumstances and settings in which we may engage people at risk of or experiencing homelessness. Outreach is also a strategy for identifying people who are underserved and engaging them in shelter, housing, and any of the services they may need. So outreach is really, it's a tool, it's a service, and as we heard from health ambassadors themselves, is a commitment to helping people access services, exit homelessness, and connect to health resources by building trust and rapport. We think about outreach and engagement. We often think of those together, but I really want to think about engagement as its own part of the process, where you are establishing rapport and forming a trusting relationship. This takes time. This is the part where, after you've been conducting outreach, you've been making those points of contact. Engagement is really getting people to connect with you and to seek out services. So, some key components of engagement, include providing the context for assessing needs. So we know that the process of kind of navigating any system, the homeless response system, the healthcare system, can be really difficult, and it can be unsure why we need information in order to access those resources. The process of engaging with someone can help kind of set the tone for why we are conducting outreach, why we need information of a certain kind, and what that information is going to be used for. You can also use engagement to help people experiencing homelessness define their health, housing, and service goals. Those are self-defined. Those are defined by the person with whom you are engaging, um, not by the outreach worker. You are there to help and support them along the way. From there, often you agree on the person's needs and next steps, and then really help them make those connections. It could be to health education, health resources, housing, shelter, other services. But this is really a process where you start to build that connection, you help people identify their needs, and then really work with them in partnership to meet those needs. We know that outreach is important because it really helps us make sure that access to services is equitable. Oftentimes, people experiencing unsheltered homelessness don't have the means of transportation. They may not be able to access site-based resources. Outreach brings resources to the person, which is also a form of trauma-informed care. We're going to be talking about trauma-informed care throughout today, but trauma-informed care is really recognizing the people we're working with have experienced traumatic experiences in their lives and really tailoring our approach so that we don't re-traumatize people and that we help them navigate that trauma as they also navigate towards housing and services. Outreach is also so important for building trust, not just with you, but with any of the systems and services that people may engage with. It can be really difficult to trust people when you have never had the experience of going to a shelter before, going to a health provider before. So having that outreach worker who's coming to you, building that trust, building a connection, and then can help navigate those systems. Could be accompanying someone to their health appointment, to a shelter, to see if this is something they want to do. Um, all of that has a really big impact on people successfully accessing the resources and services they need. As we talked about earlier, outreach really helps overcome barriers to engagement. Sometimes people want to access resources or they might be interested, but they don't have the transportation. They don't know when things are open. They don't know who to call or if they're eligible. Outreach can help break down those barriers and overcome those challenges. I'm going to just quickly go over this slide, but there are many different types of homeless outreach. And the type of outreach the health ambassadors often do is a mix of light touch that is really focused on consistency and relationship building. Light touch does not mean that it is not intensive in its own way. Often means that you are making a lot of points of contact with a lot of people to make sure that their immediate needs are met and that they know that you are there for them as a resource. So it's often light touch and housing and health focused. So health focused outreach means that you are supporting people and making the next step towards addressing their health needs and improving their health outcomes. It can include things like health education, supporting people in learning about and accessing vaccines, making connections to outpatient healthcare, as well as making connections to hospitals and higher levels of care if needed. And all of that health focused outreach really supports housing focused outreach. That may be part of your outreach, or it may be something that other organizations are doing in the community. But housing focused outreach is helping people make their next steps towards safe and stable housing. We know that housing is healthcare and vice versa. So we know the important connections between health outcomes and housing outcomes. The work of health ambassadors really help push that forward. Some other types of outreach that may be part of either a health ambassador program or the health ambassadors might work with include population specific outreach. That is conducting outreach to a population of focus. It could be youth, veterans. We have a lot of different populations of focus that may have those specific connections. Clinical outreach is conducted by a trained clinician, and they are focused on addressing immediate health and behavioral health needs. Sometimes that includes being able to prescribe medication or really provide those services directly on the street in the field. Encampment-focused outreach is when outreach is building relationships and making those connections to people who are residing in encampments. And then in-reach is when we engage individuals before they leave an institution or system of care. It could be hospitals, foster care, correctional facilities, but instead of going and working with people who are experiencing that unsheltered homelessness already, we're trying to make sure that people do not experience homelessness upon exiting those institutions. So now that we have a basis of what outreach and engagement are and what it can commonly look like, just wanted to talk about some of the guiding principles for effective outreach. So these are some of the foundations of effective outreach. In the live training that we did of this, our health ambassadors are doing this every day. These are things that are so central to what outreach and engagement are, like showing compassion and empathy is crucial that people know that their experiences matter. Being strengths-based. So not just thinking about what do people need and how can we help make those connections? That is incredibly important. But also, what resources do people already have? What are their strengths? Looking at people's resiliency and helping them really uplift that and make connections based on their strengths as well. You also know that effective outreach is person-centered. So, we're not focused on what is best for the system or for programs. This is what's best for the person in front of me and what are they defining as their goals and their strategies that they need in order to improve their health and well-being. Talked about this before, but being trauma informed, making sure that we are helping people navigate their trauma and reducing the impact, making sure we are not re-traumatizing people. Harm reduction, that means, making sure that we're working with people in a way that is non-judgmental so that they can make any incremental changes to help reduce risk and increase their health and wellness. Assertive engagement, that is, we are not just doing outreach once. And when someone says, no, I don't want to talk to you, say, okay, I'm never going to that person again. I'm never talking to that person again. Assertive engagement is respectfully and persistently offering outreach and services. We always want to respect people when they say, I do not want to engage, I'm not interested, but it's making sure that that doesn't mean that they never get outreach again, that they are never, they never have access to the great resources and services you provide. Staying there and keeping an open mind and making sure that that person knows that they can re-engage at any time. Cultural humility, so really recognizing our own experiences and positions as humans, and that we may not have all of the context for other people's cultures, experiences, but that we can really respect and honor their culture and experiences, make sure that that is reflected in our outreach and in the connections to services and housing we provide. And then safety. Safety is a huge part of outreach, making sure the outreach is effective, not only making sure that the person conducting outreach feels safe and secure in the work that they're doing, but we really want to make sure that the way we approach outreach creates a feeling of safety and comfort for the person with whom we are connecting. These are some more guiding principles, and a lot of these came directly from people who are conducting outreach all across the country. So we want to make sure we are meeting people where they are. That's not just geographically. We know that outreach goes to people where they are, residing, where they are experiencing homelessness, but also meeting people emotionally and physically where they are, making sure that we are creating those spaces for people to share as much or as little as they want and to take steps at the pace that makes sense for them. No matter what kind of outreach you're conducting, housing focused, health focused, we always want to make sure we can help meet basic needs. That also really helps to build trust. We were just talking about safety. Being respectful of personal space and property is incredibly important for making sure that outreach feels safe and comfortable for everyone involved. We know that building trust and rapport is central. It takes time. Those are without trust and rapport, is really hard to have a successful outreach and engagement effort. We know that we can create a safe, open, and friendly space regardless of the setting. Just because we are not in a site-based service doesn't mean that outreach and engagement can't be open, friendly, a welcoming space that you are creating in partnership with the person with whom you are working. We started to talk about this earlier under the kind of foundations of outreach, but we really want to emphasize the importance of cultural humility. That means having a humble and respectful attitude when working with individuals with different cultures and beliefs. As I mentioned, we realize that we cannot possibly know everything about other cultures. So this is a constant lifelong goal and process of learning about other cultures. But we do know that, as I mentioned, that respect is something that we can really bring into every interaction, being open and really creating that safe space for people to talk about what they need and about how their culture and belief impacts their needs. We really wanted to just emphasize that health ambassadors, they need to be particularly aware of what healthcare means and looks like for people based on their culture, their identity, their experience, and history. There are a lot of ways in which experiences with both the healthcare and housing system may have created traumatic experiences for people based on their culture, their beliefs, also historical trauma. So, really being aware and open to the fact that we may see that in the field. Talked about trauma and just acknowledging that the experience of homelessness itself is traumatic. So, most, if not everyone that you interact with while you are conducting outreach as a health ambassador is going to be experiencing trauma. The reason homelessness itself is traumatic is there is a lack of safety and control. There are also dangers, indignities, threats, and stigma associated with homelessness. That it's hard to feel safe, feel safe about, or to get away from, especially when someone is experiencing unsheltered homelessness. It is a constant state of needing to be aware, of being vigilant, of knowing your surroundings, and also knowing that there is certain stigma associated with homelessness that we want to be combating, and that we want to help um, create that safety in the experiences people are having through outreach. We also know that outreach itself can make our not outreach, homelessness itself can help um, exacerbate symptoms of mental health and substance use. It can make those symptoms worse, and it can also lead to mental health and substance use symptoms. And we know that it's really a cycle where people may be experiencing one and it gets exacerbated, and then that just keeps becoming a cycle, as well as um, having to navigate fragmented, unresponsive systems to meet all of those needs, not just housing, but healthcare, substance use. Sometimes people encounter the criminal justice system. It can be a really difficult thing, um, not just to navigate, but then coming back and trying to ground yourself again, to get your footing, to go back to getting any of the services that you were already getting. So know that homelessness can lead to a disconnect from social supports and the community at large. Those social supports can be so helpful in helping to not just prevent homelessness, but also, lessen some of these traumatic experiences and create a pathway out of homelessness. We also know that homelessness itself can be re-traumatizing. Um, it can lead to experiences of having to go through a shelter system over and over again, having to interact with law enforcement over and over again. It all of those experiences create trauma and recreate trauma. So when we talk about trauma-informed care, it is a strength-based approach to engaging and acknowledging histories of trauma among the people with whom we work. We know that trauma plays a role in people's lives. And so in our work, this is called the 4 Rs. We want to realize the impact of trauma and how it really impacts the journey to housing and healthcare. So just acknowledging it, knowing it. But then we also need to be able to recognize the signs and symptoms of trauma, not just in the people who we're working with, but if we're engaging with their families, when we're engaging with other staff, we really want to be able to know when trauma is present and we're seeing those signs. You may have heard of fight, flight, freeze, or fawn. Those are some of the common ways we can recognize it. Then we need to be able to respond. We know what trauma is. So how do we incorporate responding to trauma into our policies, procedures, and our everyday practices? And we want to resist re-traumatization of clients and staff who have already experienced trauma. We want to make sure that you're doing everything we can to create situations that do not lead to trauma or kind of re-trigger it or exacerbate it. And another key concept, I've talked about this throughout my part of the presentation, but we know that time and trust are central to outreach engagement. It can take multiple outreach attempts before someone is even willing to acknowledge or engage with you. So it's really important to set realistic expectations for yourself and the speed of relationship building. You could be persistent yet respectful and letting people know that you're available if they need anything. But we just want to acknowledge that when it takes multiple attempts, it takes multiple efforts to engage someone. That does not mean that you are not conducting effective outreach. It is part of the process and it can truly take time. We also know that sometimes it takes a while to engage someone. And once they do, because they trust you, it can move very fast. So just knowing that some people are going to engage right away, somebody might take some time, and there's still going to be some hesitancy. And for some people, once you build that trust, they are going to open up to you and they are going to want to engage and seek out services. As for trust, you know, seeing every interaction as an opportunity to build that relationship with the client, knowing that having consistency is so important to building trust, as well as knowing that anytime that you are interacting with someone, that is them seeing you and learning if they can trust you. So even if you are not engaging with that person directly, when you are engaging with someone else in an encampment, they see you interacting with someone on the street who's not even in your outreach role, but how people see you just conducting yourself, that is part of how they build trust with you. So just keeping that in mind as you're having those interactions and conducting your work. Finally, we've talked about person-centered outreach before, but really like this analogy, which came from a outreach worker themselves, which is that person-centered outreach is like a road trip. It is the client's car and is their trip. They are the driver, they choose the destination goal, and they control the speed and the stops. As an outreach worker, as a health ambassador, what you do is you help support that trip. You help them navigate. You offer support like uh, bringing the map. You help them operate the headlights. You help illuminate different roads that they can try. And really, you help get traction when the road feels slippery. You are there as a passenger, sharing this experience and helping them navigate. With that, I am going to hand it over to my colleague, Mark, to walk us through the next few sections.
Thanks, Alicia. Hi, everyone. Mark Mora, work with Alicia at Homebase. I'm going to be talking about best practice models and outreach and engagement in this section. Alicia just spent some time talking about guiding principles, and so I'll kind of hone in more on some outreach techniques and more practical approaches. You can go to the next slide, please. So one approach is peer support. It's well, peers refers to individuals with shared lived experiences, which may include trauma, homelessness, mental health, or substance use disorders, and other shared identities or experiences. And then peer support is key for establishing safety and hope in building trust, enhancing collaboration, and problem-solving challenges. So peer support is a really important component of the health ambassador model. As you all know, as health ambassadors, this can be really helpful to be a peer when you're trying to build that trust and confidence in order to be able to move to the next level and get someone access to services. So just keeping in mind that peer support is not just an important kind of approach within kind of homelessness services, but also in other arenas as well. I think particularly in places like where there's mental health programming or projects, and then substance use disorders as well. It's helpful to have somebody who has that life experience and can speak to, being able to provide support and speak from their own experience. Next slide, please. The other approach is housing first. For those who aren't familiar, housing first is a model that's based on providing safe and stable permanent housing to people experiencing homelessness. Then once they're in housing or on the way to housing, then you can better help people pursue their goals and improve their quality of life. And so some programs don't operate with the housing first approach. And so some of those programs might impose things like sobriety requirements or requiring clients to have a minimum income, or requiring that folks don't have a criminal record. So those are examples of some barriers that might exist in some programs. And those programs, if they have these barriers, would not be considered a housing first approach. Next slide, please. Another concept that's important, and it's called harm reduction. And this is where you focus on meeting people where they're at to help minimize any risks associated with behaviors that can cause harm, such as substance use. And so this approach is measured by positive behavior change, no matter how big or small. So it's not about asking someone or mandating that someone abstain from certain behaviors in order to get services or to work with them. And so the harm reduction approach, it honors a person's autonomy, like Alicia was talking about with the road trip example and the analogy. It honors a person's autonomy in defining their path and timeline while still promoting greater health and safety. And health education in general and information provided by health ambassadors should use a harm reduction approach to help people move towards better health outcomes at their own pace. So that's harm reduction. Next slide, please. So another helpful approach in doing outreach is motivational interviewing. It's basically a person-centered collaborative conversation style. There's a whole trainings on motivational interviewing that you can attend. But an important concept within motivational interviewing is an acronym OARS, O-A-R-S. And this stands for asking open-ended questions, affirming people, and making positive comments about their strengths, the efforts they've made so far and their past successes. Also, being able to reflect back what people are saying. That means being attentive, using active listening, and then summarizing to capture larger reflections to ensure that there's shared understanding, that you reinforce the key points made by the person. So again, that's OARS, open questions, affirmations, reflections, and summaries. And all of this is about really encouraging people to think through and talk about their own kind of reasons and motivations for wanting to change. And again, it's centering the person and where they're at and what they need. And motivational interviewing also accepts that ambivalence about change is a normal human experience, and it's often necessary in order to keep them going forward in that process of change. Next slide, please. So the last one I'll talk about in this section is critical time intervention, or CTI. It's a time-limited evidence-based practice that essentially it focuses on mobilizing support for vulnerable individuals during a period of transition. So during this period, it's providing support and beginning to connect the client to people and agencies that will assume the primary role of support. So as an outreach worker, you're making these connections and setting up this transition. Then you're monitoring and helping to strengthen the support network and skills. And then your role kind of ends when you're transferring that care and winding down the CTI services, when there's a support network that's safely in place. But the idea is this whole period is called kind of that critical time. And so that's why it's referred to as critical time intervention. So those are some important models and more practical approaches to think about when you're doing outreach. Now we want to talk about some just general tips for effective outreach. Go to the next slide, please. So on the right side of this slide, you see some quotes from outreach workers that may be helpful, but they help illustrate some of these other bullets that are on the slide. So one is being consistent, showing up how you say you will and when you say you will. And if something falls through, because we're human, being transparent and communicating what happened, and being consistent even when you think people don't notice or see you or hear you. It's really, really important. that folks see you as being consistent and trustworthy. And then another one is, especially when you're starting off with outreach, maybe you're not quite comfortable in your role, and you haven't really gone out to do outreach very many times. So one could be to start with places you connect with, and frequently visit those places where people are experiencing homelessness. And so those are some maybe places that you can kind of build up your confidence as an outreach worker. Another important one is being mindful of your approach. You want people to feel comfortable with you and your presence, and you want to stay mindful of how you present yourself and approach people. Their perception can be affected by things like what you're wearing that day, your body language, and even the vehicle you arrive in or the people you are with. And so this way, when you approach somebody, you're being mindful of, again, of all of these things, because you're providing people with information about you, without you even saying a word, as you're approaching, and this can help set you up or hurt, the case for you being able to build trust and even start a conversation with folks. So just kind of being mindful of those things. And then this has been mentioned already, but just taking your time and building to build trust. And outreach can often take multiple attempts over time for you to even start the conversation about what services or help someone might need. And in some cases, you might have spent X number of times meeting with some people or talking with some people, and maybe they're not ready to have that conversation or to go visit that shelter. And you just have to accept and understand that this is the process and every person is different. Another one is let yourself be seen. Know that when you're conducting outreach, your actions can be seen and observed by those you're interacting with, and those nearby at all times. So yeah, just know that you're not trying to sneak up on anybody, and you want people to know that you obviously are there, and you're not from that community, and it's important that you try to be transparent about your presence, and this can help maybe build trust with folks, and know that you're not trying to do anything deceptively. The last one here on the slide is being creative. Successful outreach requires constant innovation and stepping outside of the box. Some unique locations for outreach and services shared by outreach workers from across the country. For instance, they include local libraries, tattoo parlors, laundromats, convenience stores, and community barbecues or events. So just some ideas of other places you might not have been considering to do some outreach. Next slide, please. So this one is tips for effective engagement. So again, I'm just going to read a couple from the slide. So one is getting to know someone and finding common ground. When you meet someone, you're not jumping right into necessarily talking about services and how you can connect people. It should just start with getting to know people, who they are, and not necessarily as a client or a program participant. So asking them their name and how they would like to be addressed, finding common ground in terms of like topics that you might relate to with them or can talk about that aren't just about their housing situation or experience of homelessness. So it could be sports, could be talking about pets, your favorite food, the weather, just some examples. I'll jump to another one. So respecting people's time and space. Again, respecting people for who they are and what they are willing to share with you, and respecting that they might not be willing to share anything with you. And they might not even be willing to have you approach, where they're living, and not want you in their physical space or emotional space, and that's okay. And it's important not to hover or to force conversations, and you can always thank them for their time and offer to come back at another time. Another one is individualizing your approach. You might come up with a script to talk to people, and sometimes those things can be helpful or a conversation starter, but there really is no script or standard way that's going to work for every single person in every engagement. So treat each person you interact with as their own as a unique and separate person. Take time again to learn how they like to engage or interact. Remember things that you've talked about in previous conversations, people's names, their favorite sports teams. Maybe they've opened up and talked to you about their story a little bit, and that can be really dignifying for and affirming for people to remember things that they've shared with you, or the things that people have shared in previous conversations. If it's helpful, when you're done doing outreach, or you go to your car, maybe you're between encampments or wherever you're visiting, maybe you can write things down in a notepad so you can recall what people have said. Another one is checking your assumptions, checking in with yourself about any assumptions you make while interacting with people, just recognizing that everyone has implicit biases, which basically means that you are sometimes unaware of some of your opinions or perspectives that may impact our decisions or how we interact with the world. Just again, going back to just being really mindful and reflective of your own approach, and being willing to challenge your own assumptions that you are making before talking to individuals, while you're talking to individuals, and constantly doing this while you're doing outreach work, and not, again, assuming that people are going to believe or do or say or are certain things. So just, overall, just leading with respect, not forcing a connection. Another one is communicating in clear and concise and plain language, and under promising and over delivering rather than over promising and under delivering. Just some other things to think about. And then next slide, please. And we asked some of the folks during the training, what are some other tips for effective outreach? Someone said, giving compliments of folks you are talking with. Another tip was positive enforced compliments, talking politely even if they are aggressive, and trying to kind of de-escalate situations. Another one was friendly, polite language, respectful approach, and a smile. Smile goes a long way, absolutely. So those were just some tips that folks in the room, training room, had shared. Next slide, please. Next, we'll talk about outreach safety. And next slide. These are just some ways that you can approach safety, both before and during outreach engagements. So I will say that before I jump into these, that safety is not just for yourself. It's definitely important, but it's for everyone involved. For you, for other outreach workers, for the people that you are going to be engaging with, who are unhoused, and people who might be associated with them, or friends, or hanging out. You want everyone to be safe. And so one of the things that you can do is to share your location and schedule with other staff so that someone always knows where you are, including your manager or supervisor. Yeah, so if you plan to visit 4 different spots in one day, having a rough schedule where you're supposed to be at different times, and certainly the locations and addresses. Having a charged phone on you at all times, and even having maybe a first aid or trauma kit if these are things that your agency has budget for and has trained you to use. Another one is conducting outreach when possible in pairs or small groups, having somebody that you are traveling with, that you can go to a site with. Maybe you split up, or you work together to talk to people, but you always can, at the end of when you're visiting a location, you're always kind of coming back, checking in with each other. Maybe you're riding in the same car, but that can be helpful too in terms of even debriefing or being reflective of experiences. Another one is if you go with a group, wearing bright colors or matching clothes to make it easy to find and recognize outreach staff. Another is being aware of environmental safety and dangers. So knowing where you're going to be going is and checking the weather, the landscape. Is it, you know, an area where there's going to be bodies of water? Do you need to be mindful of anything? Are you near an overpass or a highway? Do you need to be mindful of traffic? And do you need to plan a route to get to a certain location where people are? So these are things that you want to plan for and be aware of. Another one is just overall supporting a culture of safety, having each other's backs, sharing information, and trusting in the measures that were put in place to protect you and honoring them. So these are just some ideas about how to approach safety. Next slide, please. And then this is just kind of an approach, a graphic on how you can keep yourself safe. And I'll just read a couple. But asking permission to approach and engage people during every single outreach encounter. You know, even if you know somebody or you've met them before, not assuming that someone's necessarily going to be comfortable that day to talk to you. So always asking permission, especially if you're going to be walking near someone's space. Yeah, and you know, if somebody wants to invite you, you know, closer to where they're staying, you know, this is where people live, and just like you would want someone to ask before entering your house or your dwelling, it's the same idea here. And then another one is assess the person's level of safety and comfort before beginning engagement. So just kind of feeling out the situation, making your best judgment about whether the situation, the person you're talking to, that it's a safe situation. Another one is listening, of course, and being respectful when people tell you to stay away or disengage. Yeah, absolutely. Take someone at their word. Don't push it. Don't hover. Another one is avoid using your phone unless you were using it to support the person you were working with, looking at resources. Yeah, just being present and understanding you know, what's happening around you. And if you're in your phone for a, you know, not for a purpose that's not related to the reason why you're there in that moment, then that could be distracting and potentially not help you in terms of staying aware of what's happening around you. So those are just some some ways that you can practice safety. Go to the next slide, please. We asked the group some tips on safety, and there's some ideas there in terms of just showing that you care, smiling, wearing a badge with your name, your picture, and organization. That can be helpful too, to kind of announce yourself, and so that people know that you are there for a specific purpose. They don't have to guess why you might be showing up to talk to them. So just some tips from the folks in the group. Next slide, please. This is our final section, just talking about successful outreach connections and transitions. Next slide. So you've met some folks out in the community and you've built some trust, and maybe some of them are ready to be connected from you, the outreach worker, to other resources. And so these are just a list that you all know what's best for your own communities, or if you don't know, then that maybe some work that you have to do to figure out what those resources are locally that you could best connect people to for particular needs. But here are just some examples. And this is not an exhaustive list. So you might connect them with homeless or housing resources. This is often coordinated through what's called the coordinated entry system in each continuum of care or community. There's a coordinated entry system where people get access to the homeless and housing resources system. They would likely get assessed and then figure out what their needs are And then they might get connected to other resources through the coordinated entry system. Another might be shelter and other emergency housing options, again, depending on what you have available in your area. But these are some other places you might connect them with. So healthcare providers, hospitals, clinics, you might help them connect with those places to meet their health needs. Maybe they have some mental health or substance use treatment needs. So you might connect them with some those kind of healthcare facilities. You might connect them with medical respite or sober living and recovery housing, or they might just need help with certain like mainstream services like SNAP or Medicaid. So you might connect them with those offices or workers. So again, this is just a list that you can kind of start from. Some of you might have way more thorough, exhaustive lists of the resources in your communities. But again, the idea is knowing where you might connect people with, what phone numbers you need to have on hand, what websites, are there particular contacts that you and your organization have at these places where you might be able to ensure that there's a connection that's made, and maybe even be able to follow up. So again, just some ideas of where you're going to be connecting people to, because the idea is that if you're working in outreach, you are connecting them to other services, other levels of support that they can get. All right, and I think that reaches the end of our training. Again, we just recorded this. We initially did this a couple weeks ago, and so we just wanted to make sure that you all had the recording of the slides. And if you have any questions, you could reach out to myself, Alicia, or Homebase staff. So thank you everyone for your time.
Thank you, everyone.